You're listening to Health Professional Radio. My name is Wayne Buckler, and today my guest is Stewart James. Stewart's the General Manager of Health and Hospitals for HammondCare. Welcome to Health Professional Radio, Stewart.
Thank you, Wayne.
Now, Stewart, HammondCare is not a name that explains a lot, so tell us what it is that HammondCare does and what geographic area you service.
Wayne, HammondCare is an independent Christian charity. We started back in the 1930s, initially caring for folk who were homeless, and today we've grown to an organisation that provides care for people in residential aged care with a focus on dementia, caring for people at home in aged care and dementia. And my particular role within the health and hospitals is providing the subacute services of palliative care, care for people in end of life, aged care rehabilitation, and older person's mental health in our health and hospital side of our business.
And whereabouts are you located?
HammondCare's principal site is at Hammondville, named after our founder, Bob Hammond. We're up the coast of New South Wales into the western area, and we've just opened up a new site in Caulfield, adjacent to Caulfield Hospital. The health and hospitals that I operate are in Greenwich, in the lower North Shore, at Wahroonga in the upper North Shore, Brayside Hospital, which is in southwest Sydney, and we have a community palliative care team out at Mona Vale on the beaches of Sydney.
So it's really quite a big operation then.
It's quite large. We started very small. The current Chief Executive, Dr. Stephen Judd, has just celebrated 20 years as our Chief Executive, and the revenues when he started were $8 million, and we're now up around $180 million and gone from a single site to multiple sites. And in fact, the spread of HammondCare is across all of New South Wales with a dementia advisory service we're contracted to the government, the Commonwealth Government. And we also provide community support packages to assist carers in end-of-life care across 7 of the local health districts in New South Wales. So from Sydney out to Burke and Broken Hill, down to the Victorian border through Greater Southern and the Murrumbidgee area, and a lot of the metropolitan parts of Sydney. And that was a tender we brought together Sacred Heart and Calvary to work with HammondCare to provide those support packages to assist people to die at home if that was their choice and the setting that they would prefer to remain in. And it's been quite a successful program.
That's good to hear. And I think that end-of-life care is one of the things that we need to do better than we've been doing. But it's also good to know that HammondCare is able to provide some choices and options there for people when they need it. Stewart, most of our audiences, are clinicians generally. And they're in the acute sector. What's your message to them? What would be the thing you'd like them to take away from having listened to us today?
I think it's to have a real good think about the subacute sector. One of the reports that rings in my mind is Christine Bennett's report on the health and hospitals that was commissioned by the then Rudd government, but it was still quite a good report, and she talked about that subacute's the missing link out of our health system. When you have acute hospitals which are really overcrowded with the ageing demographic of Australia, we really can't build enough acute hospitals to cater for the need of an ageing population. So subacute providers like HammondCare in New South Wales and other subacute providers that can provide the kind of care in an environment which is less acute and less, it's a more gentle form of care, the less hustle and bustle of a task-driven acute hospital. And one of the numbers that resonates in my mind is Rowan Hammett, when he was a Deputy Director General of Health in New South Wales, saying that there's about 30% of patients in acute hospitals in New South Wales, and I'm not sure what those stats are weighing across Queensland or other areas, but they don't need to be there. And so subacute environments like HammondCare, Greenwich and Warringah and Brayside is a perfect opportunity to provide that less taxing type of care in a different sort of environment, and clearly at a lower cost.
You're listening to Health Professional Radio with Wayne Buckler. I'm having a chat with Stewart James, who's the General Manager of Health and Hospitals for HammondCare, and we've just been touching on the issue of subacute patients occupying acute beds in hospitals and the impact that having now and going to have into the future with the ageing of the population in Australia as a trend. Stewart, is there more to be done? Are there better solutions for this issue, or is it just a case of doing more of what we're doing?
No, I think there are different things that we can do, and certainly once you get out of the major metropolitan areas, the provision of palliative care and end-of-life support in rural and remote areas and in the outside the major centres is quite limited. And so I think that there's a lot we can do to help those rural remote areas with either teleconferencing or expanding the services that governments provide so that people in rural remote areas don't have to come to acute hospitals in the city for cancer treatment or even terminal care outside of traditional cancer. So there's a lot more that we can do by uplifting the number of people that are providing palliative care, both medical and nursing, and to the particular program of providing carers in-home was an initiation of Gillian Skinner, the Health Minister in New South Wales, and it was a brilliant concept about training carers to be able to provide care in people's homes linked into specialist medical doctors and nurses. And we've had a success of about 76% now of those packages, people being able to die in their home, which was their choice, which before would have meant they would have had to have come into an acute hospital or maybe a subacute hospital bed for their terminal care. So those sorts of packages, Wayne, are things that we really should be focusing on expanding, and Minister Skinner, it was a brilliant initiative of hers to do that.
Well, it's good to hear. It's nice to know that some things happen the way that practitioners in the field think they should. Often the politics and the practicalities don't line up quite so nicely.
Well, they're tight budgets. Health budgets are very tight budgets, and they're growing with the demographics of the country. But to be able to provide at-home care or subacute care is certainly it's a more cost-efficient option than overcrowded acute hospitals where the costs are very high.
Yes, that's true. Stewart, my favourite question. In every industry and in every business and in every endeavour, there are always misconceptions about what people do, and I'd like to ask you about the misconceptions that drive you nuts and keep you awake at night.
Well, Wayne, as an independent Christian charity, we believe that bigger hands than ours support our organisation, so we rest quite well. But I suspect the biggest misconception is the role of affiliated health organisations and subacute services, which are often, as we are, run by charities, and that they are very much part of the network of health systems across the states. And that would be one of the misconceptions, that they're either private businesses or they're disconnected, but we are very much connected across the states that we operate to provide the sorts of services that we do provide that take a lot of the heat out of those acute hospitals. So affiliated health organisations, subacute providers can be unique, add value and respond quite quickly, where large acute hospitals sometimes take a little while to be able to have to shift because just their size and the complexity of their operations.
Well, let's see if today we've clarified a little bit of that misconception amongst our listeners. You've been listening to Wayne Buckler on Health Professional Radio, and I've been having a chat with Stewart James, the General Manager for Health and Hospitals with HammondCare. If you've just joined us, then you're too late. No, I'm only kidding. You're not too late. We have a transcript on our website. We have a copy of the interview both on YouTube and on our website as well. And if you'd like to catch up and download either of those, you're welcome at www.hpr.fm. This is Wayne Buckler for Health Professional Radio.